Nobody at St. Raphael Regional knew what to make of Nora Callum when she first walked through the service entrance on a gray November morning and asked, quietly, where she could find the charge nurse for the ICU. Not the main entrance, the service entrance, the one the dietary staff used, the one that smelled like floor cleaner and old coffee, and the particular kind of institutional exhaustion that soaks into the walls of every underfunded hospital in a mid-sized American city. She came through that door because she'd parked in the lot adjacent to it. And she'd parked there because she'd studied the facility map the night before, with the same methodical attention she brought to everything. Later people would say that detail should have told them something. It didn't. She was 34 years old, according to her file. Medium height, dark hair pulled back so efficiently. It looked almost military, though nobody thought to say that at the time. She wore no jewelry except a small stud in her left ear. She carried a canvas bag that held her lunch, a clinical reference binder with water-stained tabs, and nothing else that anyone could see. Her badge read Nora Callum, RN Critical Care. She clipped it to her scrubs with the same economy of motion she used for everything and introduced herself to the charge. Nurse Deborah Stanton, with a handshake that was firm without performing firmness. Deborah would later say she couldn't remember a single remarkable thing about that first meeting. That was somehow the most remarkable thing about it. The ICU at St. Raphael was not a cruel place by design. Most EUs aren't. The cruelty that grows in those corridors is an ambient thing, a product of exhaustion and proximity and the slow corrosion of watching people die in shifts. The nurses who had been there longest had developed the particular armor of people who'd stopped waiting to feel safe and started performing competence as a social defense instead. You proved yourself quickly at St. Raphael. Or you were quietly eaten alive. Nora did not prove herself quickly, not in the way they expected. She didn't volunteer for the hard assignments. She didn't try to insert herself into conversations about difficult cases. She didn't angle for the interesting patients, or defer to the attending physicians in ways that signaled ambition. She took her assignments, she worked them, and at the end of every shift she charted with a precision that the night nurses noticed first, because they were the ones who picked up behind the day's shift and found repeatedly that Nora's notes needed no clarification. Every number accounted for, every event documented in sequence, every abnormal value flagged with the relevant differential and the action taken. Kev T. Marsh, a charge nurse with 11 years on the unit, looked at one of her charts in the second week, and then looked up at her retreating back and thought, "That's either someone who was trained very well, or someone who was trained very differently." He filed the thought and moved on, because the unit was short. 2 nurses and a respiratory therapist, and there was no time to think about anything that wasn't on fire. The physicians paid her less attention than that doctor. Bradford Callum, no relation, was the unit's senior attending. A man whose ego had calcified over 23 years into something that resembled confidence if you didn't look too closely. He acknowledged Nora's existence on her third day by asking her to reposition a patient's arterial line in a tone that implied she probably couldn't do it correctly. She did it correctly. He was already reading his tablet when she finished and said nothing. The other nurses noticed that too. They noticed and they said nothing to Nora, but among themselves in the break room with its single-functioning microwave and its passive-aggressive sticky notes about dishwashing. They said plenty. That she was cold. That she was strange. That there was something off about a person who went through a full shift in the ICU. Without once looking rattled, one of the newer nurses, a young woman named Giselle, said maybe she just didn't care. And Deborah, who was more observant than she let on, said she didn't think that was it, but couldn't name what she thought it actually was. Nora ate her lunch alone, not visibly alone, not sadly alone, but deliberately alone, the way someone eats who has things to think about, and has made their peace with other people interpreting that as aloofness. She read during lunch, not her phone, an actual book with a broken spine, something dense that the one person who glanced at the cover could not identify as fiction or nonfiction, and did not ask about. She had a locker at the end of the row, inside a spare set of scrubs, a small folded cloth case that held a set of shears and a penlight, and nothing unusual, and on the top shelf a coin heavy bronze-colored, with an insignia on one side that nobody who glimpsed it recognized. Nobody asked. People in hospitals learn quickly that some things in lockers are not for asking about. She had been at St. Raphael for 6 weeks, when the situation with Dr. Callum became something that couldn't be ignored. A patient on the unit, a 61-year-old man named Mr. Aldridge, who had come in post-coronary bypass, had been declining in ways that didn't fit the standard post-surgical picture. His pressure was trending down across 3 consecutive readings. His urine output was dropping. His mental status, which had been sharp when he came out of surgery, was getting foggy at the edges. Nora had been his nurse for 2 days running. She had charted every deviation. She had flagged the trend in the notes. She had mentioned it twice to the resident covering that afternoon, a third-year named Dr. Ellison, who was bright and overworked and had learned in the hierarchy of St. Raphael's surgical ICU that nurses flagging trends were to be acknowledged and then triaged against everything else demanding his attention. He acknowledged, he triaged. He moved on. At 4:40 in the afternoon, Miss Aldridge's pressure dropped hard. Nora was already at the bedside. She had been at the bedside, in fact, because something in the quality of his restlessness in the last 20 minutes had told her to stay close, in the way that something in her had learned to read. Before she had words for what she was reading, she called the rapid response team with one hand and started the intervention sequence with the other. Not because she was improvising, but because the situation had a shape she recognized, a hemodynamic collapse pattern, with a specific differential that she had worked through in her head 40 minutes earlier, and had been quietly preparing for ever since. The rapid response team arrived in 90 seconds. They found Mr. Aldridge with a new large-bore IV already running, a fluid bolus in progress, supplemental oxygen dialed up, and a set of vitals from 60 seconds ago clipped to the bedside rail with a handwritten note identifying the most probable cause: hemorrhagic tamponade from a bleeding source at the surgical site. The cardiologist on call, Dr. Marcus Lund, reviewed the information in the 12 seconds it took him to process that the nurse standing at the bedside had already done most of his diagnostic work. He ordered the echo. The echo confirmed it. The patient went to the OR 18 minutes later and lived. Dr. Callum reviewed the incident that evening. He read the chart. He read Nora's notes from the previous 48 hours, the trend documentation, the flagged values, the differential she'd written up in the final note before the event. He read the rapid response team's account, which cited her pre-event preparation as having materially reduced the time to diagnosis. He went home, poured a drink, and told his wife that the new ICU nurse had gotten extremely lucky. His wife, a retired ear physician, looked at him over her reading glasses and said nothing. By the next morning, the version circulating in the break room was that Nora had been in the right place at the right time. Giselle said it first. 2 other nurses agreed because agreeing was easier than the alternative. Deborah, who had read the same chart Dr. Callum had read, stood at the coffee maker and said nothing. But she pressed her lips together in a way that meant something. Nora heard about the version that was circulating. She heard because hospitals are acoustically strange and break rooms have thin walls. And people talk at normal volume when they think someone isn't listening. She heard, and she went back to her station, and she pulled up the next patient's chart and began her assessment with the same focused attention. Every shift, every task, every patient who didn't know they were being watched over by someone who had watched over people in circumstances that made this ICU, with its climate control and its backup power, and its 6-minute emergency response, time feel almost calm that night. 4 time zones away, a message went out through a channel that didn't use names or subject lines. It asked one question. The response came back in 11 minutes. The response was 2 words: standing by. The morning the situation changed was a Thursday in February, cold enough that the staff parking lot had a skin of ice that nobody had gotten to yet. And the early shift nurses were still peeling off their coats when the call came to the charge desk. Deborah took it. She listened for 45 seconds without speaking. Then she said, "Yes, we'll be ready," and hung up and looked at Kevin Marsh with an expression that made him put down his coffee. "Inbound," she said. "Federal active duty. They ask specifically." She stopped. Looked at the board. "Is Callum on today?" "On at 7, Kevin said. "Get Dr. Lund, and find Nora." They found Nora at the medication dispensing station, pulling her 600 meds with the same unhurried efficiency she brought to everything. When Deborah told her there was an inbound federal patient military that command had requested she be involved in receiving, Nora looked up once, put the medication tray back with deliberate care and said, "What's the ETA? 20 minutes?" Nora nodded. She was already moving. What came through the ambulance bay 19 minutes later was not what St. Raphael Regional typically received. The vehicle was blacked out. No lights running. It pulled in low and deliberate. And the people who came out of it moved the way people move when they have trained the panic out of themselves. And replaced it with something more efficient. There were 4 of them accompanying the gurney. 2 in civilian clothes that fit wrong across the shoulders, in a way that meant body armor underneath. 2 in unmarked tactical gear. The patient on the gurney was a woman, mid-30s, with field dressings on her left arm, and her right side, 2 ICUs running, a portable monitor clipped to the rail, showing a rhythm that Nora could read from 12 feet away. She was already reading it when the lead agent, a compact watchful man named Agent Decker, who introduced himself with a badge he showed and put away faster than most people could read it, came through the doors and stopped when he saw Nora. Something happened in his face that the ICU staff watching from the corridor couldn't quite categorize. It was not surprise. It was closer to the expression of a person who has been told a thing is true and is now confirming with their own eyes that the thing is in fact exactly as true as they were told. He said her last name, just her last name, not a greeting. She said what happened. He told her in 40 seconds. The woman on the gurney was a federal air marshal who had been on a commercial flight that made an emergency landing at a regional airport 60 miles east, after a medical emergency that had escalated into something the flight crew was not equipped to manage. The air marshal had intervened. In the intervention, she had taken a blow to the head, a laceration to her right side from a security altercation, and had sustained a penetrating injury to her left forearm in circumstances that were currently the subject of a federal's incident review, and that Decker was not, he said flatly, at liberty to discuss beyond what was medically necessary. What was medically necessary was significant. Nora had been listening whilst simultaneously reviewing the field notes from the paramedics who'd taken the patient from the landing site. She was looking at the monitor, at the rhythm, at the GCS score the field team had documented, at the mechanism of the head injury. She said 2 things. The patient needed a CT head and cervical spine immediately, and the left forearm wound needed to be evaluated by vascular surgery before anyone closed anything, because the mechanism was inconsistent with a simple laceration and the peripheral pulse in that hand was not what it should be. Dr. Callum appeared at the end of the bay corridor. At that moment Ty loosened, clearly having arrived recently, and been redirected by someone. He walked toward the group with the particular forward momentum of a man, reasserting territorial authority in a space he considers his. Decker didn't look at him directly. He said, without altering his volume or inflection, "Sir, we have a designated provider. We're going to need the bay cleared of non-essential personnel." Dr. Callum stopped moving. He looked at Nora. She was already beside the gurney, gloved, speaking quietly to the patient, checking the pressure dressing on the forearm, with 2 fingers and a focus that excluded everything in the room that wasn't directly relevant to the person in front of her. He looked at Decker. Decker looked back with the particular quality of stillness that belongs to people who have learned not to waste energy on expressions. Dr. Callum said, "I'm the attending on this unit." Decker said, "Yes, sir," and said nothing else. Nobody in the corridor moved for a moment. Then Dr. Callum turned and walked back the way he came, and someone let out a breath that nobody acknowledged letting out. The CT confirmed a small subdural hematoma that the neurosurgery team, once they reviewed the scan, characterized as requiring close observation but not immediate surgical intervention. The vascular surgeon who came down at Nora's request found exactly as she had suspected, that the forearm injury had nicked the radial artery in a way that hadn't produced catastrophic bleeding, but would have created a significant problem within hours if it had been closed without repair. He repaired it. He was quiet about it for most of the procedure, and at one point, when Nora passed him an instrument with a timing that anticipated his next move by about 3 seconds, he looked up at her with an expression that was professionally neutral and personally curious. He didn't ask. Not there. The air marshal was moved to a private room, with 2 of Decker's people stationed outside it. She was awake by early afternoon. She didn't speak to anyone who wasn't cleared to hear her speak. Decker came and went from the unit with the quiet regularity of someone executing a planned operation, rather than reacting to a crisis, which is what it was. At 3 in the afternoon, he found Nora at the central station. updating the chart with the notation of every intervention and its rationale, every vital sign and its trend, every conversation with the consulting services, documented with the clarity of someone who understood that records are sometimes reviewed by people other than the next nurse on shift. He stood beside her for a moment without speaking. She kept typing. "Callum in the unit," he said quietly. "Not since this morning," she said. He nodded then. "There are people who remember you from before." She typed a line, saved it, looked at the screen, nodded him. "I know," she said. "They say you were the best trauma assessment they'd ever worked alongside." He said it without inflection. A statement of fact, the way a field report states a fact. "In conditions that I'm not going to describe in this building. People are generous," she said. "When someone helps them come home." There was a pause that held a significant amount of history in a very small space. "The patient asked about you," Decker said. "She wanted to know who caught the arm. She should focus on resting, that's what I told her." He almost smiled. "Almost," she said, and I'm quoting, "find out anyway." Nora did smile then, small and brief, the kind of smile that arrives when something reminds you of a whole category of people you've known and trusted. "Tell her the quiet nurse on 12 caught it," she said. "Tell her to rest." She went back to her charting. Decker watched her for a moment with the same expression he'd had when he first saw her in the bay. The expression of confirmed truth, and then he turned and walked back toward his post. By the time the 4 o'clock shift change arrived, the story had already changed shape twice. In the way that stories do in closed environments, where information moves faster than accuracy. The version Giselle heard was that a government patient had come in, and there had been some kind of security situation. The version Kevin Marsh heard was more specific. That agents had arrived, had bypassed the attending physician, and had asked for Nora by name. Kevin stood with his hand over notes and thought about the chart documentation he'd seen for 6 weeks. He thought about the central line he'd watched her place on a difficult access patient, using a technique he didn't recognize from any of the training modules they used. He thought about the time he'd been a moment away from calling a rapid response himself, and had found her already at the bedside. Already 3 steps ahead, already calm, in the specific way that is different from detachment. He thought about the coin in her locker, the one nobody had asked about. He finished his handover notes and went back to the unit, and did not say anything to anyone. Because some things do not need to be said to be understood. Deborah was the last to leave that evening. She was at the charge desk pulling together the incident documentation the unit director had requested. The formal record of the federal patient admission, the consulting service calls, the timeline of events. She was a thorough person by nature and a meticulous one by practice. And she went through the record the way she went through everything. Start to finish in order, accounting for every entry. Nora's notes, as always, were precise. They were also, for anyone who knew how to read clinical documentation, remarkable. The differential she had constructed from the air marshal's presentation was not the differential of a nurse extrapolating from standard protocols. It was the differential of someone who had seen the specific combination of mechanism, presentation and vital sign pattern before somewhere, and had recognized it with the immediate fluency of recognition, rather than the deliberate work of reasoning from first principles. Deborah had been a nurse for 19 years. She had worked with nurses who were talented, nurses who were brilliant, nurses who were methodical and careful and deeply skilled. She had not worked with many who thought like this. She sat with the documentation for a while. Then she closed the file, turned off the desk lamp and went to get her coat. In the locker room, passing the end of the row, she glanced at Nora's locker the way she always did. Out of a habit she couldn't have explained. And she thought about the coin on the top shelf, the one with the insignia she hadn't recognized. She thought about Decker standing in the corridor this morning with 2 armed people, and a classified patient and a specific name on his lips. She thought about Dr. Callum in the break room at noon, eating his lunch in a silence that was unlike his usual silence, saying nothing about the morning, looking at his phone. She thought about 19 years of learning to read hospitals, to read people, to understand the difference between someone performing competence and someone who is so deeply competent that the performance has become unnecessary. She pulled on her coat. She picked up her bag. She walked out through the same service entrance Nora had used on her first morning, into the cold February parking lot, with its patchy ice that someone had finally salted. Nobody at St. Raphael Regional had understood. On the day Nora Callum walked through that door, what they were seeing. Some of them were beginning to understand now. And down the hall, in room 12C, behind a door with 2 federal agents outside it, an air marshal who had asked about the nurse who saved her arm, was looking at a ceiling she couldn't identify and thinking, wherever they find these women, they should find more of them. Some of the most important people in any room are the ones nobody thought to look at closely. Nora had known that for a long time. It was, in the end, one of the things that had kept her alive, long enough to stand in that corridor and keep someone else alive too.